Hi, Dr. Rosales. I'm Haley Morgan, and for my Teach Back module, I think it's important to start with learning what goes into the process before you even get to the Teach Back stage. So, initially, starting off with when the patient arrives to the hospital, we know that discharge planning really starts from the admission date, and it's important to, firstly, keep the patient up to date on everything, using plain language, making sure that they understand their condition, their diagnoses, what steps are coming next in their care in order to better prepare them for when they will be discharged home with their education and how to implement those changes in their lifestyle. The next important thing, I believe, is to incorporate the family into their care. We know that patients are often not living by themselves. They usually have family members or caregivers who want to also be active and engaged in their loved one's care and their health. And it's important to make sure that not only the patient is getting that education, but any caregivers or family members that are wanting to be involved also get that same level of education that the patient will be getting. Sometimes the patient depends on those family members for their care, so it's even more important that they get that education from the start. And it's also important to emphasize the fact that this is a partnership between the patient and the hospital staff, whether that be the physician, the nurses, the techs, anyone. It's a partnership with how their care is developed and carried out during their stay in the hospital and then after discharge as well. It's also important that we set up follow-up appointments before discharge for the patients. So nurses will generally have a call back to check up on the patient within 24 to 48 hours and 14 days after patient discharge, checking in with them, making sure that they understand everything's going all right, answering any questions the patient may have had since being discharged. It's also important that we set up those follow-up appointments for them with their physician or outpatient caregiver. So whether that be seeing a physical therapist or their primary physician within 7 days post-discharge from the acute care setting, it's important that we get that done and have that communicated to the patient before they're being discharged from the floor. Another good way of following discharge education is using the ideal discharge planning strategy. And again, that's including the patient discussing, any new medications, any medical equipment that they may be going home with that they've never had before. Need to discuss any side effects, when to call the doctor, when to come into the ER, any test results, what's the next step of their care, explaining all those things to them. It's also important to, again, have that family engagement and setting those follow-up appointments for them. And then lastly, it's important that the entire multidisciplinary team is caught up with what's going on with the patient. A major cause of sentinel events is poor communication. Communication is one of the most key aspects of patient care, and if the entire disciplinary team is not communicating with each other, not keeping each other up to date on patient condition, what they can and cannot do at that time, it's going to cause issues. So making sure that the entire team across the hospital and outpatient centers as well, making sure that they are on the same page is going to help the patient so much more in the long term. And it's important to use plain language with patients. So instead of using words like hypertension, hypotension, using high blood pressure, low blood pressure, instead of saying low sodium diet, say low salt intake or low salt diet. Keeping things plain for lower health literacy levels and kind of judging where the patient may fall on the health literacy continuum is really important in order to titrate their care better so that they can understand it and they'll be able to put those education materials into practice at the level that they're comfortable at doing. And now we'll get to the Teach Back. And for my Teach Back, I will be teaching my patient what they'll be doing for taking nitroglycerin at home. Okay, Mr. Morgan, so you were diagnosed with stable angina, so you know that when you exert yourself too much, you're going to get some chest pain. That's just your heart trying to compensate for the increased workload that you put on it. So you're getting discharged home with tablets called nitroglycerin, and they're going to be given to you to use when you have those attacks of acute pain. And you're going to use them so that it lessens the workload on the heart, opens those blood vessels, and oxygenates your heart better. So when you feel an acute attack of chest pain coming on, what I want you to do is I want you to sit down and take that first dose of the nitroglycerin. You're going to put the tablet under your tongue and let it dissolve completely. Do not chew, swallow, or crush it. Just let it dissolve completely. If you still have the feeling of chest pain after 5 minutes, you can take a second tablet. If you still have chest pain after another 5 minutes, so 15 minutes after that first onset, then you can take a third tablet. If after the third tablet you still have chest pain, I want you to call 911 or go to the nearest emergency room so you can get checked out by a professional, okay? Some common side effects from the medication: because it's opening up those blood vessels, it's going to cause a drop in blood pressure. So you can get this thing called orthostatic hypotension. All that means is you'll get low blood pressure when changing positions. So move slowly, don't just get up suddenly from when you're sitting down. Move slowly and give yourself time so you don't accidentally pass out or anything like that. Headaches are another really common side effect of this. So don't freak out thinking anything's wrong. Headaches are a common side effect after taking the tablets. It's very important that you do not take nitroglycerin if you've taken Viagra within the past 24 hours. That can cause some severe low blood pressure, and that is when you can start getting into real trouble. Some other side effects you can experience while on this medication is dizziness, again, headache, low blood pressure, and tachycardia, which is a fast heartbeat. Okay, so Mr. Morgan, can you tell me what you would do if you have an acute attack of chest pain?
I will take one nitroglycerin pill and let it dissolve under my tongue.
Yes, and how many minutes are you going to wait before taking your second dose?
5 minutes.
5 minutes. And can you take a third dose after another 5 minutes?
Yes, I can.
And after you take your third dose, if you still have chest pain, what are you going to do?
I'm going to call 911 or go to the nearest emergency room to be checked out.
Perfect. And will you chew or swallow these tablets?
No.
You're going to just let it dissolve under your tongue, right?
That's right.
Okay. And headaches, is that something to be concerned about?
No, it could happen.
Okay, perfect. All right, Mr. Morgan, thank you so much for coming and talking with me.
Thank you.